makes more sense. As you know, current vaccines do not prevent transmission. This is part of the yes, because there are a lot of. So the Israeli data did not say that 8 weeks later after the shot, the vaccine is not effective. Somebody completely misread the data. If that's what's been communicated to you, that's wrong. If you read that, let me correct this. So the shot does not decrease transmission past 8 weeks, but it still improves chances of not having severe illnesses or death. And that seems to last for a minimum of 6 months or approximately 6 months. And after that, it begins to wind down. So bottom line is you're still going to get disease, but it's going to be mild. That's the point of the current set of vaccines. Pfizer hopes, now that's a hope, that Omicron-specific shot in August, let's say, is going to block the transmission of Omicron too. But we yet to see this. We don't know that actually that's going to happen. So that's the recommendation. So that's why now, if you're traveling or if you know you're going to be exposed, I think you should get one now ASAP and then still get another one late in fall. This is sort of how I'm thinking. Now, that's my personal take. It's not necessarily CDC take. CDC take is get it now. The reason I'm adjusting that recommendation for those who should be getting the fourth shot now, which is, by the way, not everybody, right? So if you're under 50, first person I'm seeing here is Ashley, so I don't think she should be getting it just because she's not over 50. I hope not. I'm sure she's not. And so, so she's not qualifying for the DC guidelines, neither am I. I'm close, but I'm not quite there yet. So, of course, this situations. If you already had a fourth shot,
you might want to turn off your video.
All right. Well, okay. Is that better?
Yeah.
All right. Let's hope so. All right. Let me show you guys a few things. I haven't fully finished the talk, but and it's a courtesy of one of our current. You guys seeing my slides?
Yes.
Okay. So, basically at this point, CDC says that 2 weeks ago it was 30%. Now, BA2 is 60% in DC area. So basically now in an upcoming couple of weeks, everything is going to be BA2. I'm sure that's what according to me, reading the literature and sort of the fact that Israel mostly has BA2. So it's already here. So some of the updates on treatments, I'm not going to talk about monoclonal antibodies, but I want to show you a little bit about the early remdesivir, the Pine Tree trial. And then we're going to talk about the Jefferson trial on vitamin C. That's my, and I know there are questions, so I'll come back to that. So this is the trial that showed 87% efficacy for the remdesivir, and it must be administered quickly. So if you miss that original window of onset of symptoms, it doesn't seem to work. And really, I think the drug should be reserved for patients who are at the higher risk. The side effects are uncommon, but they sort of can be there. And we talked about the fact that the problem with this pill is interactions with medications because it's a combination pill. And one of these medications is a liver suppressant, so to speak, or cytochrome P450 modulator to increase the dose or increase the level of the other drug. So patients on multiple medications should be super careful with this drug, and definitely this should not be taken without talking to someone, okay? So if you're about to get it, please talk to your provider, or if you don't have one, find somebody. I do want to talk about this a little bit. I actually had a patient call me the other day about Fluvox and say, hey, what about this? There's been a pretty significant study coming from Brazil. It was the double-blind randomized controlled trial that showed pretty significant decrease in mortality. But the tolerance is horrible. I prescribed it twice because patients asked me, and both times patients had severe dizziness and diarrhea. And the reason for that, usually when we start antidepressants, which is what this medication is, it needs to be titrated. So you start at the lowest dose and you gradually titrate. Here you start at the pretty high dose right away. at 100 milligrams. And I just think that that's a high, it's just too much offset. And a lot of people not going to tolerate it. I had 2 out of 2 not tolerated. So I don't know, the study quoted 25%. So now with the Paxlovid and the vaccine, I just don't really see the place for this medication. Okay. So lastly, I wasn't fully prepared. So what I'm going to show you with the Jefferson is just a couple of, sorry guys, it's going to see my messy desktop. I apologize. I didn't finish preparing. I'm covering hospital. So this is the Jefferson study. It's actually came out earlier, presenting it now. I talked to Mark Levy in person a couple of weeks ago. He's the PI on this study. He's the outmost expert on a high-dose intravenous vitamin C. So prior to this study, all the trials on high-dose vitamin C were run different places. They were actually not run as a high-dose bolus. They were all run as a continuous infusions, and none of them were positive. And the reason for that, in my opinion, is that when you don't have a bolus, it's actually not just my idea, it's everybody's in Mark Levine's circle who knows him well enough or who follows his works. You really need to give doses upwards of 50, 75 grams per dose over a couple hours to spike the level extremely high so that the vitamin C quickly converts or pushes conversion of hydrogen peroxide. And that's what tends to kill the cells infected with virus. That's what we think. And the Marek's studies, Dr. Marek and several others that were doing the low dose but continuous, like 24 grams a day, but over full 24 hours. And China was doing the same studies that really didn't show much of really conclusive benefits. Okay, so let me show you a couple of things here. And again, I'm apologizing, it's not very graphic. I didn't have time to prepare this well. So this is it's not a big study, but nonetheless, so they were using 44 patients in the active study with half of that in a control. And then the primary outcomes, this is the primary outcome. So a number of patients who achieved clinical improvement within 72 hours after randomization, you can see a pretty significant difference. So this is 72%, this is 86%, and with a p-value of 0.15. So, you know, it's a kind of a borderline result, and clinically it's a borderline result because most patients still improved. And so, you know, how do you take this? Well, there's some benefit for sure. How big is it? You know, it's interesting part is right here. So number of patients discharged within the 72 hours, there you have a pretty big difference. You have over 50% shift there. But if you want to look at this a bit more graphically, it looks like this. So there's a big separation that occurred after day 2, that a lot of patients on ascorbic acid went home versus, you know, patients had to wait a lot longer in that original immediate phase. So, you know, it's not, if you think about this in terms of hardcore outcomes, like we like to look at mortality, for example, it didn't really produce sort of a massive result. But, you know, nonetheless, you know, there were some other benefits. So people defervesced, so they stopped having fever very quickly on ascorbic acid. You know, so they didn't have fever compared to those with standard of care. You know, and serious adverse effects were higher in ascorbic acid, but when they actually looked at what that meant, it didn't actually, they defined it serious, but it wasn't actually serious by any clinical meaning. It simply means that we're somewhat more fluid overloaded, which you would expect given that vitamin C is a fluid load. So, and then, you know, the decline was the same. So this is basically what this means is that even though there were patients admitted into the hospital, they were actually less sick then. And this is probably also consistent with the fact that this study started way into the pandemic and not early on. So with that, I am gonna stop and then go to questions, okay? All right, and Janet, help me out if you need to. Okay, how realistic is it we'll have a pan vaccine? Forget the pan vaccine, I don't know what that means. I don't know who puts this in people's minds. No, like just forget it. There's no such a point. It's never gonna be developed. pan vaccine means that you have vaccine against all variants. This is a virus that's rapidly mutating. It's not going to happen. So they will have an Omicron-specific vaccine, just the way I predict. Well, we'll see what happens. Okay, so I am 80, and after three Pfizer doses, I got my Moderna as a booster. It's okay. Yeah, it's a half a dose. That's fine. You know, if that's what CDC recommends. But even a half dose of Moderna is higher dose than Pfizer. So that's my main thinking. But again, I'm putting this out just because I see more patients with Moderna boosters having side effects. But again, it's probably not a significant difference. And I don't think that so I think it's perfectly fine that you did this. Yeah, cases going up in DC. There's been a 30% increase in last week. So the week before, there was relatively flat. The last 2 days, we had 50% bump per day. But the total increase is still, like if you actually look at the absolute numbers, their increase is still very small. So is this going to mean something in upcoming weeks? No, we'll see. Their thinking is that this is all quite expected because masking mandate is off because, you know, people just fed up and don't use the isolation and the precautions as much as we used to. By the way, interestingly, Hopkins, Dr. Frame's alma mater, and Georgetown going back to masking mandates since they've seen some number of students sick on campus. Just a little tidbit. Okay. Okay. Thanks for Cecile. Thanks for posting that out there for people to see. Yeah, that's what I thought, that fluvoxamine is commonly used for long COVID. Ashley, do you have any data to say what the results of that is? I've heard of that, but I haven't seen much of anything in terms of an actual data.
Yeah, I think it's just being used. I don't think that there's any longitudinal data yet to really support it, but the thought process is the inflammation, I guess. Yeah, treating dysautonomia.
It wouldn't surprise me that if it's used smartly, meaning carefully titrated up, and if some side effects evolve, cut the dose back in half, et cetera, or right, and give people more time to talk. It wouldn't surprise me if it's going to work.
Yeah.
Mm-hmm. Yeah, so the dose of vitamin C, it's a daily dose. It's per kilogram. It has roughly 50 grams per day in net bulk. First dose half, and then the dose went up to a higher dose of 50. And the 50 grams is what we routinely use in the office. And yes, it's intravenous, and it's as a bolus, so that it's administered within about 1.5 hours to 2 hours, depending on the dose and patient's veins, et cetera. So it's a rapid administration. And just to give you a contrast, in Marik's studies and China study, they were using either Q12, they were using it once a day, but they were using it as a slow drip over anywhere between 7 to 12 hour, I think, the frame. So it's a very, very different principle, because that only fixes vitamin C deficiency, and the idea of that was to try to do this as a prevention or treatment of sepsis, and it was actually never panned out. Here, this dosing, and it's for 5 days in total since admission. First, right on admission, and then for 5 days or less if patient gets discharged. Because remember, 30% of patients on vitamin C got discharged within 3 days. So that also tells you how not sick that population was in that trial, right? Because the anticipation is that patients were much sicker. All right. Wow, it's only 2:20. All right. Well, I guess I went fast without realizing how fast I went. Well, all right. So let's see if there are more questions. We have time. And Judy, can you actually speak about this since you already posted that in?
Go ahead and unmute yourself.
Okay, that's what I'm doing. Yeah, I went to get. We were at the emergency center because my husband was diagnosed with COVID yesterday. He found out he had a positive test. So I went today to get my PCR test, and I asked the doctor if I could get the Paxlovid is how it's pronounced. So the doctor was so wonderful. She actually looked online to see which pharmacy in the area had the Paxlovid. And it happened to be right across the street from where we were. So I went right, oh, and then she called the pharmacy to make sure it's not, I pronounced it wrong. But anyway, she actually called the pharmacy to make sure they actually had it. And they did. I went over there and they said that I was the first person who had gotten it there. Now, I will tell you, I'm on the eastern shore of Maryland. It's in Ocean City, Maryland. But I'm happy to get it.
And we're glad you got it too.
Thank you so much. Yeah, this is wonderful. I hope that actually, back up. I hope that nobody has to use it because you don't get it. But if you do get it, I hope that it will have that effect. So, all right, let's see if there are any other questions. So for healthy late 40 with 3 Moderna with upcoming trip to UK. Nope, I don't recommend it. Just, there is reason why I think CDC stopped short of not recommending it for people younger. I actually was surprised that they put cutoff at 50. Idea here, they basically recommending it. They basically.
Misha, you got to do something about that connection.
Yeah, I don't know what I can do. I should have went home, but I tried to switch to my phone. Give me a second. Okay, how about now?
Yeah, you sound clear.
Okay, all right. Well, I'm using my phone as a hotspot right now. I don't know how long it will last. So yeah, so my understanding of between the line read on the CDC recs is this. They're basically saying, look, even if you have a once thought that you may be somewhat immune compromised, don't hesitate and get the shot. That's how I see it. You know, so Anna Maria, if you feel that that's the case with you, by all means, you know, go get a Pfizer shot or Moderna. But the way I look at this is this: if we are healthy enough, I way rather everybody waits until Omicron specific shot, because it means that you're gonna get shot now and then you're gonna get another one. And we've talked a little bit about this, but I want to emphasize this again. There's an increasing voices in the advanced immunology communities that says, do not over-vaccinate. Do not do the too frequent shots. It will drop your immune system. It will decrease the responses to viral infection. It's a principle of overstimulating immune system. It's way over my pay grade. Don't ask me to explain this. This would need to be somebody who can actually translate all of this. But I am hearing this over and over again. I don't have interest in figuring out exact mechanism of any of this. But that's just my particular reason. I'm also judging it based on the fact that you can think of it this way. Okay, how bad is it? Am I going to travel to where am I traveling? Where are we traveling? UK. Okay, so like if I'm traveling to UK, well, how bad is it if I get it there? If I get this BA2? Well, you can use my experience. I'm probably, Anne-Marie, around the same age, same 3 shots, just like you. Well, I got Pfizer. Okay, all 3. But you know well, you may get the same way sick I got. Now, what is the chance of that? And do you want to take that versus what I'm explaining? I think that's basically the crux of it. All right. Yeah. So so the low IgA it's basically means you have some immune deficiency. You probably would want to get a 4th shot rather now, right? And then get the 5th one sometime late fall, as I discussed. Or if you know you're going to be at the very high risk environment and you may be not having IgA, but let's say you are over 50, that could also be a reason to get it. So I recommended 2 of my patients this week to get the shot now, anticipating a 5th one in late fall. So roughly 6 months later. Okay. All right. Anything else? Anybody else? How's everybody doing, by the way? This has been hard. For me, things have been, continuously crazy because of what's going on in Europe. There may be some touch of hope because it sounds like there is since basically Russia completely failed at war, they're finally starting to figure out how to get themselves out of the mess without losing political face. So that to me sounds like a good way. So hopefully that could be, as there's some resolution in upcoming weeks. But atrocities seemingly increasing. I'm sure you're following the news. It looks pretty crazy. So yeah.
Misha, are you still trying to get over there or no?
No, I couldn't figure out how to do it. It's just too much depends on me here, and I couldn't, we ended up donating a lot of money and then also continuously sending some other way of supporting. I've supported few people coming here. And I'm assuming that in upcoming months, as those 100,000 refugees gonna start pouring in, we may be able to do more work here. I guess stay tuned. I know there's several, even in our own Office of Integrative Medicine, we have a Ukrainian staff member, Victoria, who I'm sure her friends and relatives have been affected. So it's pretty close to home, and I'm sure that we will continue supporting the process. And actually, our spiritual teacher gave a special prayer, which I'm going to read if people don't mind. It's pretty neutral. It's not any, but I just wanted to share that because that's also something that I've been doing as part of kind of my internal workings. We've been doing more healing services every week, and actually several of you I know have joined, and some of you have been routinely joining. Thank you for doing that. So this is just a protection prayer. Or faithful or protector, by your hand of protection, may bodies and minds be saved from harm. May every danger be averted. May hardened hearts be softened. May hostilities cease. May the spirit of kinship flower. May enmity be abandoned, and may peace and freedom prevail in every land. It's kind of a nice way of, I think, for me to end my part and pass it on to Ilana. Ilana, thanks so much for coming back. Wonderful to have you. You, as always, in some absolutely stunning decor compared to me. My decor is, medical office. But so yeah, if anybody still have questions, send me them to me personally. I may need to leave a couple of minutes early. I may need to go back to the hospital, but I'll see if I can stay. Thank you so much.
Thanks, Misha. Thanks, Dr. Kogan. And thanks everyone for being here. I'm so glad to be back again. I'm Ilana Rubin. I'm a certified nature and forest therapy, forest bathing guide, and founder of Kindred Nature based in Northern Virginia. And so again, today I'll be offering a sample of remotely guided nature therapy or forest bathing. And so encourage everyone to just take a moment to get comfortable. And, if there's any elements of some nature being around you that you want to connect with or bring closer into the space where you are, you could go ahead and do that, or to think of one. For me, I brought my fig tree, FIG fig tree, not a fake one, but a real one. And just keeping me company here, as well as the tapestry that Dr. Kogan was mentioning. So I just want to offer to begin for everyone who wants to share in the chat. You can share your name and just any kind of nature being that might be near you or that you're bringing to your mind and heart now. It doesn't have to be like the favorite one, or it doesn't have to be a specific species name, but just share your name and something from nature, just to kind of bring that into this space here. And anyone who wants to, welcome you just to add that into the chat to make this a little more interactive. Or, you know, if you're, okay, great, now they're popping up here. 19-year-old dog Elvis, bird song. Lovely, and you can continue to add in there if you like, or just to hold that with yourself. And if you were here the last time, about a month ago when I was here, it'll be a little bit similar, but just to share with anybody who it might be the first time with this kind of practice, it's all about holding space, bringing attention to our senses and the nature that's in us and that's around us. And within the time frame that we have today, this is just a sample. And other times, you know, this can be much longer and we would go into other invitations. But we're going to start with one similar to before, called The Pleasures of Presence. And I'm seeing more notes coming in too about precious stones, a delayed elm tree. Lovely. Thank you for sharing. And now just taking a moment to just arrive in this place where each of us is in this moment and noticing what we see around us, perhaps looking in all different directions to see who and what is here with us. And if there's anything that would make you feel more comfortable, just to go ahead and do that for yourself. And when you're ready, if it feels right, now you might like to lower your gaze or soften your gaze or close your eyes. Just take a few breaths at your own pace. Noticing where your body may be in contact with something else. And what does that feel like? Perhaps to have that support or connection with the physical world around you. I wonder who and what different beings have been in this place where you are now over time, in the past, through now, and who and what will be here in the future. And bringing our attention back to where our body is in contact with something else. And if it feels good, perhaps just relaxing and leaning into that. Wonder what it feels like to have your body in this moment, in this place. Now shifting our attention to our sense of hearing. I wonder if you notice the sound of your own breathing. And what that's like. Now expanding your sense of hearing out farther from your body. What other sounds are out there, perhaps in the room or space closest to you? Or if there might be silence. And then listening out farther, are there sounds beyond the immediate space and room that you may be in that you can hear? Or even any sounds that might be playing in your imagination. Now really opening up our ears to any and all sounds, or what might be the farthest away sound that's reaching you. And taking a moment to notice if any of these sounds or any pauses or quietness feels good to you, to invite that to stay with you. And next, shifting to our sense of touch. Feeling if there are any sensations on your skin. I wonder what the feeling of any clothing or textures around you might be like. Perhaps exploring the feeling of the air around your hands. If there's any sense of the temperature, level of humidity, any movement of the air, or stillness of the air. And if there's anything around you that you'd like to reach out and explore the textures of, go ahead and do that. Next, shifting our attention to our noses and focusing either on sense of smell or perhaps a sensation of air around or moving through your nose, whatever feels most comfortable for you. Maybe you'd like to explore what sense or sensation might be in the air around something that you were just exploring the texture of. Maybe trying out breathing through your nose or smelling through your nose. Just feeling how your nose feels in different directions and different places in the space that you're in. Now shifting our attention to our mouths and our tongues. I wonder what you can notice with this part of your body. Perhaps something in the air, perhaps something within your own mouth. Maybe there are different tastes or textures you can feel with your tongue in your own mouth, or whatever is feeling okay for you. And now noticing, is there anything that your body is asking of you? And if so, feel free to give that to yourself, if that's an option. And now, if it feels comfortable to you where you are, you might like to stand up slowly, or you can stay however you are. And just feel what it's like now to be in the position that you're in. And slowly begin to turn your body in a circle and just stop whenever your body says to stop. And if you're not standing, you can try just moving your body in some way until it feels right to stop. Now feeling into this place, noticing now where your body's in contact with the physical world around you. And in a moment, but not just yet, we will open our eyes or refocus our gaze. And when you do, you might imagine that what you're seeing is like a painting that someone has lovingly created for you. So whenever you're ready, you can slowly open your eyes or refocus your gaze. Just take in whatever you're noticing with your sense of vision. Perhaps noticing different levels of lightness and shadows, or anything else that catches your attention. And now we'll have just a couple of moments to notice movement or motion or signs of motion, maybe within yourself or maybe in the place around you. Now noticing if there's anything that has brought some bit of enjoyment or pleasure during this, to bring some attention to that and invite that to be with you. Now take a couple more breaths at your own pace. And we will come back together again here. Now I'd like to invite anyone who would like to share in the chat whenever you are ready, just to share what you are noticing. And I know sometime before I counted down, but in this case, just please share whenever you're ready. Just share what you are noticing. Spring. Thank you. I'm noticing clouds I see outside my window. I see sunshine. Thank you, Monica. I'll just give space for another moment for anyone else who might be holding something or starting to type something that they want to share of what you're noticing in this moment. Kathy says there is so much more beauty out there than what I normally notice. Thank you. Alyssa says rather perfect. The Thich Nhat Hanh drawing of "This Is It" hanging above my computer screen, seeing it afresh. Thank you. Now, if you're still typing something or writing something, feel free to continue. We're not going anywhere. We still have several more minutes. But in this moment, I would like to offer a short little mini invitation here for us to explore textures, and going to give us all about 3 minutes. I'm going to actually turn off my video for this. So for 3 minutes, feel free to just explore textures around you. And if you like, you may want to bring back a texture or just holding that texture in your memory. And we'll come back again in 3 minutes, and I'll call you back with a little bit of humming or singing. So just make sure you either come back by 254, or that you're within distance of hearing. So 3 minutes, and we'll come back together, explore textures. And we'll just come back together again from our explorations there. And just one more time, sharing, if you like, in the chat, what are you noticing? And if there's 1 or 2 people that wants to share and unmute themselves and share verbally, you're welcome to, but otherwise, those are welcome to share in the chat. What are you noticing? And I'm noticing, I found one of these little fig tree leaves that had fallen a bit ago, and how feeling the textures, I also hear them, it's all crinkly. I enjoy that. Alden says, I have nothing but bare walls and work clutter. I should really hang some pictures. Thank you. And Ashley says, thank you so much, Ilana. Thank you. And Judy's earlier share, the gentle rustling of the trees outside. Thank you. I'll just hold for another moment in case anyone else is still writing something, or if anyone else wants to share. What are you noticing? This will be our final sharing for this, so that I can hand it back over for a couple minutes for the wrap up to Jeanette or Dr. Kogan. Kathy, I went and peeled an orange and noticed the texture, color, temperature, and it tasted even better than usual. Thank you. Monica, I enjoyed the smoothness of a stone in the room I am in. It was also pleasantly cool. Thank you. All right, so now we're coming back to our everyday life here, and just want to share again, my name is Ilana Rubin, nature therapy guide, forest bathing guide, and founder of Kindred Nature. I offer longer experiences, extensions of this that are in person or remotely guided for private groups, as well as larger groups, can be families, can be a group of patients, all kinds of different things, or with a congregation, many different groups. So really welcome folks to connect with me, share your feedback or your ideas, or if you want to plan anything, I'll put my website in the chat, and there should also be a link to it in the follow-up email, as well as a link to a couple of sites from other organizations that talk about some of the benefits for our well-being from engaging with nature. So thank you everyone so much for sharing this time and this space with me and with each other. Really enjoyed this and hope you found value in that. And also I'll just add that in doing experiences like this, the effects can be a little different for everybody. Maybe you feel it right now, maybe you'll feel it later today, maybe tomorrow or another time. So I will pass it back over to Jeanette and Dr. Kogan. Thank you, everyone.
Thank you, Ilana, so much. And I hope everybody have a wonderful weekend. We're finally getting spring, so enjoy. I think Janet put already in the chat that the next week we're going to have our own Ashley. Ashley, what are you going to do? Qigong? Oh, she may have left already.
Yeah,
And
Ashley had to step out.
yeah, and we're also going to have our GWCIM own Dr. Jonah Yekel, who's an expert in chronic inflammatory response syndrome. So he's going to talk a little bit about that. And stay safe. It's kids' spring break, but I will try to show up. Actually, I don't know where we're going to be. We were supposed to go to Las Vegas, and then from there drive to Los Angeles. Kids wanted to go to every most famous skate park, but believe it or not, we couldn't find tickets for less than $700 a piece to Las Vegas. And we said, that's just crazy to go for you guys to enjoy your skate parks while we are looking at your skating, falling down, breaking something. So we canceled and we're going nowhere, except for Boston for a couple of days. So everybody enjoy the weather, get out. I think it's important. Spring is coming, and we'll see you next Friday.
Thank you for your prayer. Thank you.
Oh yeah. Oh, by the way, I put it in chat. I don't know if everybody's seen it. So if you want to copy paste that. Yeah. So yeah, Caroline, thanks for thinking.
Yeah, and we're thinking about, of course, Ukraine and Russia every minute of the day. Actually, you can't. Yeah. It's devastating. Thank you. Have a good weekend.
Thank you. It's a beautiful prayer.
Thank you.